Center, Link, License, and Launch. It's a super exciting effort at Virginia Tech, and it's been developed over the last couple years to support partnerships with industry, engage alumni around tech-heavy topics like the ones today, and to support innovation in the university. So we are so glad to be here with you today as we ourselves work toward more creative ways to engage our alumni. So we have a packed agenda today with really smart guests, and the main feature will be predictive analytics meets pandemic. And so I'm here to get us kicked off. Of course, it's a very timely topic, and it's one that helps us think about the research spaces that are making a difference through efforts of our faculty and our community, and that will be ever more important as we move forward. So we're super excited about that. And I'm standing between this really great panel and a few comments to get us going. So for sure, virtual work life has had lots of downsides. I know we're all zoomed out, but we also see a bright spot in how easy it is to assemble folks around such important topics, and like this one. So thanks for being part of our experiment. So let's get to our event. So I'd love to introduce you to Lauren Childs. Lauren is an assistant professor in the Department of Mathematics at Virginia Tech. Her current and past research includes mathematical and computational models using diverse techniques and wide applications, including infectious disease, immunology, and ecology. A main focus of her work is understanding pathogenesis and spread of infectious disease. Lauren, thank you so much for being with us today. We're proud of the work you do for Virginia Tech, and what a timely topic. So thanks.
Thank you, Brandy, and thanks for that great introduction. Good afternoon, everyone. I'm very excited to be here with you today and to serve as the moderator for our panel. Let's go ahead and get right into things. You're in for a real treat today. We have quite a dynamic panel of experts here. We'll begin with some introductions. So those of us joining on the panel today are Dr. Ron Fricker, the Associate Dean for Faculty Affairs and Administration in the College of Science, Dr. Alexandra Hanlon, Director for the Center for Biostatistics and Health Data Science, Dr. Alan Latimer, Socially Determined Senior Data Analyst, and finally, Ms. Sadaf Rouhani, a graduate student from the Data Analytics and Applied Statistics Master's Program in the College of Science, which is located in that greater Washington, D.C. metro area. So to begin, we'll have each of the panel members do a quick introduction of themselves and a short overview of their work. So Ron, let's get started with you. Tell us more about yourself and your work.
Thanks, Lauren, and thanks to Link, License, and Launch for the invitation to be here. I'm really excited about the panel. As you mentioned, I'm the Associate Dean for Faculty Affairs and Administration in the College of Science. I'm also a Professor of Statistics in the College of Science. My background is in statistics, really is applied to defense and national security problems. And in that role, I began working on the application of statistical methods to detecting bioterrorism attacks about 20 years ago. It's hard to believe. But over that time, that research has kind of morphed into having much more of a sort of public health-like aspect, looking at disease surveillance in general, and of which bioterrorism is sort of basically a subset and sort of has, unfortunately, a real importance and resonance today. I've written a number of papers in this area, and actually I have 2 books. The first is called Introduction to Statistical Methods for Biosurveillance, with an emphasis on syndromic surveillance, a very specific kind of surveillance. And just recently, I co-authored a book with Dr. Steve Rigdon, who's at St. Louis University, and it's called Monitoring the Health of Populations by Tracking Disease Outbreaks and Epidemics, Saving Humanity from the Next Plague. And I imagine we'll be talking a bit more about that as we go on. So again, thank you for the invitation. Look forward to the panel.
Thank you, Ron. Our next panelist is Alex. Alex, can you go ahead and tell us about yourself and hear about your work?
Sure. So thanks for that beautiful intro, both Lauren and Brandy. I am a collaborative biostatistician, and I direct the newly formed Center for Biostatistics and Health Data Science. We're in Roanoke. Our center provides expertise in analytics and data management to research projects that are led by Virginia Tech researchers and beyond. In our center, we work within a team science environment, and we work to understand disease trajectories, to identify effective prevention strategies and treatment approaches. And ultimately, our goal is to work with our domain experts to improve mental health, physical health, and quality of life outcomes. So our data that we work with comes from prospective clinical trials, as well as observational studies, including claims databases, electronic health records, and large data sharing platforms. Our work generalizes to various populations that include older adults, children who are born with heart defects, and people struggling with mental health disorders, and as well as substance use disorders, and beyond that. COVID has impacted our work in many ways, like halting our patient enrollment for our prospective studies, as well as follow-up visits and data collection. And certainly, COVID has changed our patterns of care that we will use in our observational studies. And I look forward to telling you much more about all of these things throughout the webinar, and it's certainly an honor being among all of you today.
Thank you, Alex. Our third panelist is Alan. Alan, can you go ahead and tell us about your great work and your association with Virginia Tech?
Absolutely, and thank you guys so much for having me here today. I know that it's a challenging time, and I'm so glad that we're stepping into the gap as a community. I lead data science for a company called Socially Determined. Our focus is on social determinants of health and how those influence patterns of health utilization, disease outcome. My background's actually in computational mathematics, and that led me to looking at various problems. And then when I came across Socially Determined, I knew it was the right fit. We are in a challenging time where vulnerable populations are all around us, and having the ability to measure those using both commercial data and open source data to really understand what the inequity is in our country today and how that affects health outcomes was super important. I didn't know how important that would be until the last 2 or 3 months. And it just ends up in the news every day. I hear another story of how socially vulnerable populations are affected not only by COVID-19, but then the subsequent downstream outcomes that will occur. So I'm very excited to be here today. I am a Hokie through and through. I have all 3 of my degrees from Virginia Tech. I think I told some folks the other day, my family has 13 degrees from Tech, if I count my 2 brothers and I. So we are very excited to be here today, and thank you.
Thank you, Alan. And finally, Sadaf. Sadaf brings a student perspective to the panel. Sadaf, can you tell us a bit more about your work?
Thank you, Lauren. So my name is Sadaf Rahani. I'm currently a graduate student at Virginia Tech. I'm part of the first cohort of VT's Data Analytics and Applied Statistics Master's Program in the Northern Capital Region. And when I'm not studying, I'm working as a student cooperative at the U.S. Postal Service's Office of Inspector General in Roslyn, in their analytics division of their Research and Insight Solutions Center. And right now my work is currently mostly focused on data refresh and some analytics work.
Thank you, Sadaf. Let's go ahead and get started with our first question. The global pandemic has made data analytics, epidemiology, and community health household topics. These fields are in a global spotlight like never before. And of course, you see them all in the news every day. How does your work now intersect with what's happening on our national stage? Why don't we start off with Ron for this one?
Thanks, Lauren. I guess, given my introduction, for me, it's really a complete intersection. So as I mentioned, I've been working in sort of this area of bioterrorism surveillance for the past 20 years. It's morphed into disease surveillance. And until now, most of that work has really been hypothetical. What if a pandemic were to occur? How would we detect it? So I spent 20 years thinking about it, and boy, here it is. And in that sense, this is sort of surreal. In fact, doubly surreal. So if I could tell a little story, actually back in February, I had the opportunity to go to Switzerland and teach in the Presidential Global Scholars Program. It's out of the Steger Center for Virginia Tech. And I arrived there in late February, flew through Milan, Italy, just as the outbreak was hitting northern Italy. Just after I arrived in Canton Ticino, southern part of Switzerland, right where the Steger Center is, right next to northern Italy, they had their very first case of COVID-19. I'm not even sure we called it COVID-19 back then. But anyway, I had this front seat, sitting in the Steger Center, watching the outbreak sort of spread through northern Italy into Switzerland. I was only there for 2 weeks, but by the time I left in 2 weeks, it had literally swept through Europe. It was overtaking Europe. I came back to the US before it really quite hit here, but literally a week later, we had to close Steger Center and bring all the students home safely and wonderfully. But by the time I got here, we were just starting that process and going through it again here. So really to answer your question, it's a complete intersection, sort of living through the research I've been doing for a long time.
Thanks, Ron. Alex, maybe you can tell us how your work is intersecting with the current COVID epidemic?
Sure. So in terms of data analytics, what we're doing in our center right now is we're modeling social distancing behaviors over time and using a time series model at the county level, starting with the arrival of the virus in March through the placement of policies, both local and state policies, and then through this phased reopening. Basically, we're looking at data that is as current as possible repeatedly. And we're looking at this in conjunction with case counts and mortality, along with other mental and physical outcomes like overdose, ED, suicide, mental health episodes, and things like that. And so based on this type of modeling that we're doing, we are able to predict health outcomes as a function of this distancing, along with these county level characteristics that might look like the urban versus rural setting, population density, race, ethnicity, income makeup, education, risky behaviors, number of hospital beds, social vulnerability, vote share, and things like that. And this type of modeling will allow us to understand the long-term consequences of our day-to-day choices that might not be apparent, right away. And in terms of epidemiology, which really refers to the study of the distribution and determinants of health-related outcomes within specific populations, most of the work that we do revolves around looking at predictors of health outcomes, like, as I said, predictors of overdose, as a function of social isolation, like I just mentioned. We can look at these things in the population overall, as well as within, again, rural versus urban setting, being in a certain race ethnic group or SES group, and so on. Other examples of things that we might look at within this context would be health outcomes as a function of pandemic-related sanitary practices, the presence of COVID antibodies, pandemic-related stress and anxiety in pregnant women, economic hardship, social service disruption, and many more. And in community health, we're working with leaders in addiction to understand optimal treatment strategies for substance use disorder during disruptions like this. This work is a result of the spike in overdoses and mental health episodes that we're currently seeing. So early in the pandemic, the authorities lifted the requirement that remote communication tools be HIPAA compliant. And this resulted in the use of telehealth via FaceTime and Zoom and things like that. And this allows for innovation, but we really need to understand data on efficacy and how to deliver these treatments within crisis situations. So we're really looking at things like that right now as we speak.
Well, it sounds like you and the center are certainly very busy with all of the things that you're involved in related to COVID. And I think speaking to some of the social vulnerability leads right into work that Alan is involved in. So Alan, maybe you can talk a little bit more about that as well.
Okay. As I alluded to in the introduction, our primary focus is on social determinants of health and how those affect people's patterns of usage. Same exact stuff that Alex was talking about. In particular, one of the things that I think has been overlooked that we are really focused on are long-term effects of this. So we're all in the moment right now, and we're thinking about COVID-19 and will someone get a disease, or will the community, have a spread of the disease? What we're really concerned with and taking a big focus on is, how is this going to play out economically, socially, 6 months from now, 9 months from now, as we start to recover the country? And, how is that going to affect the health outcomes for individuals? For example, if you're a diabetic who cannot get their insulin because you can't get to the pharmacy, or you have barriers to get to your physician to get your prescription refilled. These are all things that start to become a concern. I think one of the oddest things in this entire pandemic has been the fact that in many, many rural communities, including our own, there's been mass layoffs at hospital systems across the country. How frightening is that at a time when we really could use health resources? We're laying people off because as we shut down the economy, there was just no one going to those rural hospitals. They'd all been focused into urban areas. And so we're looking at that kind of resource distribution and how that might affect long-term outcomes.
Great, thanks, Ellen. Sadaf, how has your work been related to what's happening with the COVID epidemic?
Yeah, so with the pandemic and then the lockdowns and the economic downturn following that, there was the round of stimulus checks that went out. And so the Postal Service is responsible for dispersing them. But with that amount of volume of checks and just like the vast potential for fraud, the Inspector General's office is responsible for investigating any claims of fraud or misconduct. So the organization has just been busy kind of investigating that, especially with trying to deal with, all the complications that come with the pandemic as well.
Great, thank you. It sounds like a lot of different aspects of the pandemic, from sort of being on the front lines there in Switzerland as things were happening, to thinking about hospitals and healthcare, and even the economics of it as well are being touched on, which leads us right into another great question based on sort of your background and area of expertise. What are some things that you wish more people understood about our current situation in the pandemic? Maybe Alex, you can start us off on that one.
Sure. So just to scratch the surface, I wish that folks understood the importance of social distancing early on and why we really wanted to flatten the curve. So our goal with university decisions like moving so early on to distance learning, which was then followed by public policy, was, to reduce the time it takes to spread the disease across the communities. So just so we could buy time for understanding the virus and come up and understand effective treatments, and to avoid the need for difficult life or death decisions, and avoid unnecessary deaths, and to lessen the impact of moral distress on our frontliners. I also wish that folks understood that there are different strains of the virus and that it potentially mutates over time. And this basically means that outcomes of interest like morbidity and mortality are also changing over time, and that different geographic regions may have different profiles that describe those that are high risk. And this variability and seemingly contradictions over time does not mean that science is useless or it should be disregarded. Rather, we expect these things. So I wish folks understood that. And lastly, I wish that people understood that we as data scientists we really need to have a complete understanding of where our data comes from, how it's collected, and how this might change over time as well, to interpret our model findings with integrity and to be able to generalize our model findings well. Our predictive analytics are really only as good as our data literacy there.
Yes, I think that's a very excellent point that, you know, data is an important, and understanding the data is really an important part of doing the modeling as well. Alan, maybe you can speak to a bit about what you feel you wish people understood.
Yeah, I wish people really understood the full impact of social determinants of health on not only the current outcomes, but the long-term outcomes. You know, we're seeing reports of the fact that the systemic underutilization of the health system has created a health underpinning that has exacerbated the disease across our country in certain pockets and certain vulnerable populations. So I really wish people understood that more, because I think there's not only a social impact to this, but there's also a real economic effect that we have for all of us. And so understanding that this isn't something that happens to somebody else, it's something that's happening to all of us collectively. And I wish we would just be more cognizant of that. And you know, as Alex said, the data supports it over and over again, that socially vulnerable populations are more at stress at times like this. And so.
Thank you. Sadaf, can you add to that?
Yes, I think what would be nice was if people kind of understood a little bit more about statistics, and that probably doesn't help when some of you know, the graphs and models may look a little complicated. So I think just like working on communication and making sure the general population kind of understands where public health leaders are coming from would go a long way towards making you know, this situation a little easier to go through.
Great, thank you. Ron, maybe you can speak a bit as well to what you feel you wish people understood better in this situation.
Sure, and just let me, I guess, echo my other panelists there, because I think they're all exactly right. All of those things are really important. But I would also say, maybe before I say what I would wish people understood, is to say, when I was in Switzerland, I came back from Switzerland to a country that didn't really understand the science of the virus. And since then, I've been very impressed with how the general public and the news media really have become educated on this. So it's really interesting to watch. You know, when we got back, people didn't know what epidemic growth was. Flattening the curve was not a common statement. People didn't understand the importance of testing, or why it took a couple weeks from getting the data to actually, from policy intervention to actually seeing the effects in the data. All those things weren't well known. Now it's really well known. Now we're talking about reproduction numbers for SIR models in the news. We're talking about, you know, various graphs of data. We're talking about false positives and false negatives. It's really impressive. So that's all really good. I think if there's one thing I would say that I wish people understood more, is that this virus is really good at exploiting weaknesses. So the idea of different areas doing different things is good sometimes, but it's also dangerous in the sense that, as we're sort of seeing in a few areas around the country right now, it's there exploiting weaknesses. And unless we attack it, sort of as Alex said at the top of this question, unless we attack it scientifically and carefully with good data, we're going to continue to struggle with the virus, and it's going to continue to exploit our social issues.
Great. I think that dovetails really well into a question more directed to you, Ron. We've mentioned how predictive analytics in healthcare are needed in healthcare and epidemiology like never before. And you, as you mentioned, have recently written a book related to that. Can you speak a little bit more to the premise of your book, why you wrote it, and some key takeaways?
Sure, be happy to. So first of all, I said earlier, my background is a pretty unique mix of sort of defense-related life experiences. I was in the Navy to start my career out, and then research expertise in statistical methods really associated with anomaly detection, actually sort of in the commercial world, was all about kind of quality control methodologies. And 20 years or so ago, when I was at the RAND Corporation, those intersected when we were looking at questions of how do we detect bioterrorism attacks on the United States. That was actually the question. But as I said, it morphed into this sort of disease surveillance problem. And this book that I wrote, well, the first book I wrote was very mathematical. It was, statistical methods. And what that meant is it didn't sell many copies, right? It really didn't reach a large audience. I wasn't about selling books, but I wasn't reaching an audience. So the American Statistical Association, CRC Press, got together 3 or 4 years ago. They teamed up and they did a series on statistical reasoning in science and society. So it was all about sort of helping society understand scientific methods and statistical methods applied to societal problems. And so Steve Rigdon from St. Louis and I got together and decided to write this book, this general book for a general audience. And so that kind of leads me to another digression, I guess, which is, we've been working on this book for 2 years. And it was all about the idea of how epidemiology is applied to sort of improve public health. That was the goal. It goes through lots of case studies. In it, we were talking about SARS and MERS and Ebola and all these diseases we've heard about in the news. And literally, Steve was out here in Blacksburg back in December. We were sitting in a hotel working on page proofs. And he said, I've been hearing something about this, something's going on in China in this place called Wuhan. And I hadn't even heard about it at that point. But we're doing the page proofs. He said, well, we got to add something into the book. So this is December, 6 months ago. And so we wrote, here's what we wrote. We said, consider that on November 16, 2019, Chinese authorities diagnosed a case of novel coronavirus in a 55-year-old man and quarantined 28 people who came in close contact. That's all we knew. That's what we wrote back then. About 2 weeks later, we said, oh, geez, a lot has happened in 2 weeks. We had to update the book. And so we wrote in there, in early 2020, an outbreak of coronavirus occurred in Wuhan, China. This outbreak may be linked to a seafood and animal market, which closed on January 1st. As of mid-January, the disease has killed 2 people and sickened more than a dozen. Some passengers at airports in the United States will be subject to enhanced screenings. So 2 weeks later, it had killed 2 people. The book was supposed to be published in February, but by early February, we actually stopped the presses, if you will, right? We said, pull the book off because so much had happened in the next 2 weeks that we stopped it. We added a couple pages. One paragraph we wrote reads as follows. As this book goes to press, the 2019 novel coronavirus is challenging governments and health organizations to contain it. As of early February, the World Health Organization has declared a public health emergency of international concern, and travel bans to China are being implemented. And then a few more things. So that was literally 5 months ago. Here we are now in June with 120,000 people have died in the United States, almost 500,000 worldwide, and it's hard to imagine. So we wrote the book to educate people about the use of epidemiology and disease surveillance. And I mean, in 5 months, the world has changed completely.
Thanks, Ron. Maybe you could remind us of the title of your book?
Oh, yeah. So we thought we were being kind of cute at the time, and it became prescient, if you will. So it's called Monitoring the Health of Populations by Tracking Disease Outbreaks and Epidemics, Saving Humanity from the Next Plague.
Yes, that seems very prescient of a title. Thank you for all of that. I think we'll move on to a question directed more towards Alex. So Alex, you have talked a bit about the Center for Biostatistics and Health Data Science and what it is that you do there. Can you talk a little bit more about how it's changed since the pandemic hit, and how do you anticipate that work evolving in the future, and sort of what's on the top of the list of things you're thinking about at the moment? Sure.
Thank you for asking this question. And Ron, that's a fascinating story regarding your book side. So our center became official almost exactly a year ago. We've grown already to a team of 7. And as I mentioned in the intro, we have offices in Roanoke, but we're academically housed in the Department of Statistics and the College of Science. And I also mentioned briefly that we provide our expertise to health-related projects that are led by domain experts at Virginia Tech and also beyond that. And what we do is we collaborate with these investigators in the area of study design, power and sample size calculations. We write grant proposals. We do tons of statistical programming, data visualization, certainly data analyses. We work with folks on dissemination of their scholarly products like abstract submissions, manuscript submissions, poster presentations, conference presentations, and much more. We also serve as a data coordinating center. We provide data management services, including database design, data linkage, and we also do mentoring and education. We engage in educational lectures, workshops, and certainly webinars like this one. So we serve as short-term consultants with investigators as well as long-term collaborators. So for our short-term projects, we've just launched our Zoom drop-in hours twice a week. So if people are working on projects, they could just drop right on in and ask us questions. For longer-term projects, we really seek to work with folks all the way from study design through data acquisition, through their data analyses, and then certainly through dissemination. And we hope that rolls on over into their next projects. We seek long-term relationships. So we're working on various COVID-related projects right now, some of which I've mentioned already, like our collaboration with a current PI, principal investigator that focuses on substance use disorder, treatment delivery options that are resistant to disruption and are the most effective in terms of treatment, relapse, and recovery. We have another study that we're working on with a Virginia Tech researcher to examine the impact of pandemic-related sanitary practices on specific health outcomes. And we're working with another PI to describe changes in the delivery of transitional care among older adults that are discharged from the hospital. And we're studying the responses that are made by nurses and other care team members in response to COVID to make sure that the implementation of this transitional care model is carried out as designed, both overall and also within subgroups that might be defined by diverse race, ethnicity, and social characteristics. We work with another investigator to look at the impact of social isolation on the use of antipsychotics and sleep outcomes in nursing home patients with cognitive impairment and restless leg syndrome. We're working with this is a newer project. We're working with a team of investigators in New York City, and we're looking at the impact of COVID-19 on a whole host of surgical outcomes. So I mentioned earlier our center project on social distancing is a function of demographics and public policy. And in relation to COVID counts, mortality, and other health outcomes, we're collaborating with Carolian investigators to study the interplay between race, ethnicity, vitamin D, and COVID susceptibility. And finally, we're working with an FBRI investigator to study the impact of the pandemic on pregnant moms with respect to the pandemic-related stress and anxiety that they've experienced. Once the pandemic hit, our prospective studies halted enrollment, and we were not able to collect data from participants that were already enrolled. Many of our enrolled patients dropped out, and we spent the last few months trying to identify novel and safe ways to collect data that will be well received by our participants and not compromise or bias our outcomes. That's tricky. We do know that our observational data that will rely on acute care resource use, like hospitalizations, ED use, primary care, and also that rely on electronic health records during this period, they're going to be completely disrupted, and that data that we use during this period will require special attention in our data analyses and interpretation. And at first, with all this, we thought that our research would come to a halt. We were concerned that our workload might slow down as the pandemic took shape. I think we all felt this level of uncertainty, but in reality, we are crazy busy. We're busier than ever. Many of our projects are COVID related, as you just heard, And we're finding that clinicians who were otherwise busy in the clinic are now making use of their time by doing research. And then, so they're really coming to us and seeking us out for our expertise. And we realized that this virus is going to be with us for a long time. And we expect that our data collection methods are going to change. They're going to rely more on telehealth and novel strategies. And we expect to see differences in the number of people who are willing to participate in research. And we also expect that the characteristics of those who are willing to participate are going to differ in terms of their demographics and also clinical characteristics. We expect that our outcomes of interest are going to change in many of our studies. Alan touched on this early on. We think that the long-term effects and comorbidities that COVID patients experience are going to change what we see out there in terms of our patient population. We expect that our observational analyses are going to be difficult to interpret, as I touched on. And, you know, we expect our lives to be wildly different in ways that we can't know until this passes and we all settle in.
Yeah, it sounds like there's been quite a change in the center in terms of the focus of the work, but as you said, not necessarily that expected slowdown, but just sort of a shift of where things are going and trying to think about how to move forward in the most resilient way possible. As you mentioned, some of what you're working on sort of is very synergistic with things that are happening at Socially Determined, which has become a great industry partner for Virginia Tech. So maybe Alan can tell us a bit about some of the efforts in the response to the pandemic from that direction.
Sure. Well, I'll say that from the very beginnings of our company, there was always a desire to reach back to the university. The company was founded by a couple of Virginia Tech grads. And there was always this desire, if there was a way to tap into the resources that the university could bring, that would just help our company. So it started with, we've done research with the university where we funded research inside the statistics department. It became a great source of student talent to bring in both at the internship level and as full-time employees. And then we started to see great opportunities with capstone projects. And this spring, we had an opportunity. We sat around thinking, is there some way, I think, Alex, you were part of this conversation, is there some way that we could bring the university and Socially Determined together to really start looking at these problems? And what we found out was, as COVID-19 unfolded, so many things started to evaporate for our students. The interactions, the ability to talk about the problems in an informal setting as opposed to something like this where we've all gotten together, but to just have the conversation that says, how is this affecting us? How is it affecting the health of the country? Those were gone. And so one of the things that was very important for us was to figure out ways to re-stimulate that conversation. So we were very fortunate to be able to work with the statistical engineering program to help guide their semester-long project, and then to also sponsor Data Fest. The American Statistical Society, I guess, Association, right? ASA, help me out here, Ron. ASA has, they canceled Data Fest, and all of these students who had wanted to participate in this competition were now out of a competition. And we thought, well, what if we brought people together all over the university, undergraduates, graduates? We opened the aperture up and we said, look, talk to us about how social determinants are affecting COVID-19. We'll give you a bunch of data that we have, open source data, some feature generated data that we have. What do you think is going on? What's the long-term effect? And the results were amazing. The innovative ideas that came out of that, the approaches to what could be a problem, what might not be a problem. And it was really a great example for us. And we're actually taking many of those ideas and using that to influence how we think about the problem in our industry. So for us, having the university as a partner is invaluable. We every day are appreciative the relationship we have with Virginia Tech. So this spring, you know, when everything was tough, the university stepped up. And I just was, as a company, we were very, we were just very, very thankful that the university was here at that time.
It sounds like a really great story of Virginia Tech and Socially Determined stepping in to do the Data Fest. And Sadaf, you were involved and participated in Data Fest, so maybe you can tell us a little bit about your experiences there and what you took away from the event.
Yep. As Alan mentioned, Data Fest was a COVID-19 social data competition sponsored by Socially Determined. And it was a great experience, especially as I was a part of a team with 3 of my wonderful classmates. And it was sort of an intense few days because you have like all this data and you kind of have to sift through it, kind of figure out what story we wanted to tell with it, and, you know, research additional possible data sources. But I definitely came away from the experience with more appreciation for what, you know, epidemiologists and statisticians and healthcare analysts worldwide are doing, because it is very difficult than it seems to separate, you know, the signal from the noise, so to speak, and analyze all this data and come out with meaningful conclusions.
Yeah, and it's really great to have that next generation of scientists putting their heads in the game and helping out as well. So it's great to have you there. I think we'll shift to, there's been some really great questions from the audience. We'd like to get a few of those in. Before we do that, for those of you who joined late, I just want to remind who we have here today. So I'm Lauren Childs. I'm an assistant professor of mathematics. I'm moderating for the panel for today. We also have Dr. Ron Fricker, Associate Dean for Faculty Affairs and Administration in the College of Science, Dr. Alex Hanlon, Director for the Center for Biostatistics and Health Data Science, Dr. Alan Latimer, who is at Socially Determined Senior Data Analyst, and Ms. Sadaf Rouhani, a graduate student from the Data Analytics and Applied Statistics Master's Program. So to sort of kick us off, I know that some people have been interested in where is the best place to get data on a more local level. And I think maybe Alex, you could address that on websites and places to look.
Sure. So the main websites that we've dug into and the ones that correspond to the C3.ai data lake, they include the Johns Hopkins dashboard, the New York Times dashboard, and the COVID tracking project, and the WHO website. So we really like the Johns Hopkins dashboard. It gives you information on total confirmed cases at the city and county level, deaths and recovered cases at the country level, and then deaths, recovery, test counts, and hospitalizations at the state level. And when I speak about this, I'm talking about what you can find on the website, but there may be more precise data that would be found on their Git repository as well. The New York Times has a prominent dashboard, but we have not been able to access it due to a paywall. And then the COVID tracking project has information again on counts for test results. They also have information on hospitalizations, ICU admissions, ventilator use, recovery, and mortality. And this is all at the state level. And this is the only source that we have seen that details their outcomes by race makeup, although it's heavily caveated. And the WHO website gives information on cases and deaths at the country level across the world. So like I said, we like that Johns Hopkins website. They're known for their county level breakdown. They do have city level information. And we are looking actually at integrating our current work, our time series modeling, with their website using a Shiny app. And in particular, what we are looking at doing is building graphical web apps to track and forecast various aspects of the pandemic, including county level social distancing behavior and infection rates.
Yeah, and I'll put a plug in for that GitHub repository that Johns Hopkins uses. We also use that, Alex. I think it's a very valuable resource. So if you're looking to assimilate all that into some other database that you can play around with, that's the place to go.
Awesome. Thank you.
Yeah, I think it's really great to hear about that. There are a lot of different sources out there, and to sort of be directed towards ones that have a lot of data, and especially publicly available data. I think that's really great. One thing I'd love to mention about that Johns Hopkins website is that it was a brainchild of a first-year graduate student who was sort of tracking the epidemic in China when it was first started, and threw that idea out there, and they thought it would just be for researchers, and it's come much farther beyond that and really been a resource for the public and for everyone as well. So I think that's a fantastic place. Another question that's out there that I think is really important is, clearly the pandemic has elevated the role of modeling and data analytics and public health. We've all spoken, we're all involved in that direction, but it also has created some mistrust from the public and what the methods are using. And there's been some reports of what's happening with modeling. So how can we address these discrepancies, and how should one interpret some of the modeling out there?
From my standpoint, I think it's important to get the story right. So I think too often I see that we try to draw correlations between things that aren't necessarily correlated, and try to say these two things are related and just arbitrarily do that. I think it's important as data scientists, and I speak to my team all the time about this, it is so important that we bring domain knowledge into the room when doing data science. It is very, very easy to just let numbers speak random stories for you. And so when I look out at data, I want to make sure that there's a combination of people that understand the domain, that understand the data that they're dealing with, and that can bring the right expertise to analyzing that data. I think that speaks well to what Johns Hopkins is doing. You can trust that they're bringing public health officials, they're bringing physicians, and they're bringing data scientists to all into the same room. I think that for our company, that's what we're trying to do. We're a company founded by physicians and supported with several public health individuals and then data scientists. And we all get into the room together to say, look, is this a meaningful thing to investigate? Before we even start trying to gather data, we try to understand what is the story that we would like to know.
So I just want to follow up on that. So Alan, I just really agree with everything that you say, always have since we first met. So I echo the importance of this team science. We are heavily engaged in team science. A data scientist must sit at the center of the table with all of the other experts around them, the computer scientists, the engineers, but certainly the domain experts. And it all goes back to your research question, right? So what we've been seeing here with this pandemic is that all these reports are like flying off the press. Some are being retracted, right? And some of them, many of them don't include the domain experts, which is just really, again, so critical. And it goes back to what I had mentioned earlier, that we really must have a real good understanding of the source of our data, how it was collected, what it represents. We need to generalize to the best of our ability, and anything that we put out there, we need to recognize our limitations and observational data. We just have to recognize that and be completely transparent. So yeah, that's it.
Yeah, I think those are very good points, especially with the pace that the research and information has been flowing. So much has changed in the last 6 months. No papers published on COVID as of 6 months ago, and hundreds and thousands being posted since then. Another question from the audience, sort of what are the main directions where you think that data analytics can be really helpful in the pandemic? And Ron, sounds like maybe you have a thought there.
Maybe. So no, actually I do. And you're involved in this, Lauren. So I thought I would mention that at Virginia Tech, we have a group now of faculty and students who've gotten together. And to answer the question, what we're trying to do is build some models that might help inform how we open the university in the fall. It's a really hard set of decisions to make. It's a really hard thing to do, but we've been spending some time trying to collect data and trying to build some models that would help us sort of assess strategies and decisions and how we might do that effectively. Again, it's a hard problem, but I think we've been doing, you guys have done some great modeling and doing some good work in that respect. So I think that's one place where we can really use this. In addition, I guess, just to the things we've been talking about, you know, the use of data just to sort of personally inform our decisions and personally understand what's going on around us.
Yes, for sure. There's definitely, you know, using sort of quantitative information for reopening the university has been something that a number of us have been involved in, but other aspects, Alan?
I was just going to mention that, you know, in our field, we're looking at health systems, providers, and how do we sort of improve the way we generate care for our communities. So as an example, one of the things that we're looking at today is doing food prescription programs. So instead of just immediately going off the shelf and prescribing diabetes medicine or just, you know, prescribing another pharmaceutical to fix the problem, the payers, the pharmaceutical industry, the local grocery stores and the providers all got together and said, what if we just started prescribing food? We just gave people food to fix the problem, healthy food. And so the first question is, well, do we even think that's going to work? And there's where data science starts to become such a valuable tool to change the way that people can think about a problem and to inform that what the efficacy of that solution might be. And so we've seen some extraordinary results from that because we were able to first formulate a question, as Alex and I were talking about. You formulate a question and you say, okay, look, can we serve the community in a different way than we have historically done and get better outcomes? And then we can use data science to leverage into that, to identify high-risk populations, to see whether there's actually an effective, if the program is effective. And so I think data science is at the heart of what we're doing almost everywhere now. And you know, that's an example from our industry, but I do feel like it's finding its feelers in everything we do.
Yes, thank you. Certainly there's a lot more than just the direct health outcomes that are associated with this. There's a lot to, you know, we've heard about some of the long-term concerns from Alex and Alan and so forth. So there's a lot of things to think about, and some of the economic and social aspects from Sadaf as well. So certainly all involved in there. Another question coming in is, are you aware or involved of any sort of controlled studies looking at case care databases to try and correlate particular variables and you know, determine new targeted therapies out there? I'm sure we've heard a lot about you know, vitamin D and blood types and things like that, whether there's been things that you're involved in or know about that are sort of quite controlled and looking for those new types of care.
I can jump in here. So, you know, over the years, we've done some population health studies that basically relies on health system data. And, you know, we look at basically, you know, what the top chronic conditions are. How are people utilizing the system in terms of their primary care visits, their specialist visits, their the ED department, you know, hospitalizations and so on and so forth. And we can look at that in various subpopulations, as I mentioned before. Well, you know, we've been sort of chugging along, and if you look at years, you can see that we're trying to reduce unnecessary hospitalizations and things like that. Well, we've got this total, bump in the road here where things are going to change drastically. So what we can do is we can use this observational data to that's coming out of our electronic health records and claims database and so on. And what we can do is we can look at the characteristics of folks now that are utilizing the system. We can look at the change in the different chronic health conditions that we're observing. And I suspect that'll be drastically different. So we're going to have a lot more neurological issues. We've seen different conditions, younger people with strokes. Basically, early on, they thought this was a respiratory disease. And then now it just really has wreaked havoc on all of the systems of the body. And so there's for those folks that really were hit hard with the virus, they're likely going to have long-term effects that we just don't know about yet. And of course, then there's the whole mental piece of this, which is going to be enormous, because it's not just the virus itself physically, but it's this economic burden that people are bearing. It's the stress, it's the anxiety, and all those things. So our system's going to be used differently. People maybe who have real serious needs are not even going to use the system because they're afraid. So there are all these different things that are going to change that we really have to take into account. And then once if we ever do get an understanding of the landscape, once we hit maybe a steady state, whenever that happens, then we can think about different treatment strategies, interventions, how to reach people who really have needs but who are afraid to use the system. And I'm talking all kinds of social services, clinical care, mental health care and things like that. So I hope I answered the question.
Yeah, it's really great. And I think you bring up a good point that it's not just trying to find solutions to the short-term health morbidities that we know about related to COVID, but also taking into account what are those maybe unknown long-term consequences as well. We're only 6 months into this pandemic, so we don't know what is in store in terms of if there are any longer term consequences. And it sounds like there's certainly some that are known to happen related to some of the mental burdens that's been put on even people who aren't infected. Another question from the audience, this one may be a little bit challenging, but we'll see if we can answer it here. The CDC reports that the death from all causes is at or below historical rates, in particular for more recent months like April. Can you suggest any explanations for why we would see a lower all-cause mortality being reported? Ron, you want to jump in there?
I'm going to try again. So one thing I can say for sure is when the CDC ranks sort of causes of death, the top cause of death is heart disease. The second highest is cancer. The third highest is accidents of all various sorts. So we are social distancing. We are all at home. It could well be that accidents are down and other things like that compared to what we're experiencing for COVID. I think the thing to note, though, is that overall, COVID, probably by the end of this year, will be the third highest cause of death in the United States. So there are models that predict 200,000 deaths by October. The annual number of deaths from accidents is about 170,000. So it could well be that at the moment we are kind of offsetting there, but I think over time that may not be the case. That's what I know.
Certainly a very good point that, in addition to the virus, it's changed our life in many other ways as well. That has a number of other consequences coming out, like you said, less mobility, less travel, less accidents, that sort of thing as well. So, maybe we'll take one more question from the audience here. So Ron and Alex, you guys have mentioned modeling that's been involved. Will VT be, using these models to really understand any potential outbreaks that happen on campus or in Blacksburg, and sort of what tools are out there to the general public to understand risk better?
So maybe I'll start with the first part of that and maybe toss it to Alex for the second half, which is, as you know, Lauren, but the audience doesn't know. I mean, we are working on surveillance schemes for the, for the campus. Some really innovative ones potentially, including wastewater surveillance. So the goal is to try to surveil a campus and be able to identify outbreaks really before they get too big. Obviously, as a modeler, we also know to be very cautious about these sorts of things. It's unclear at this point how well we will do that. But I'd say we are making the best academic try we can to both figure these problems out and then try to put sort of interventions in place for the fall.
Lauren, we haven't been involved in any discussions at that level, but certainly, having, I think, really, again, it goes back to data integrity and us being able to engage in basically a data collection type of, set up a system so that we can collect data from the students as they're being tested, and maybe their mobility, and then as case comes, we can model all of those things together. But the first step is to really, figure out what are the key components, what is it that we're trying to track, and ultimately, of course, it is to keep everyone safe, students, faculty, staff, everyone. How do we do it? But it will come back to having good data that reflects all of the important things that we need to capture, and then feeding that into our models. And it would be nice that if we could set these things up so that we're modeling all of this and collecting it real time, so that if we are able to do this in such a way that we're looking at it in real time, then of course, then we can intervene as quickly as possible.
Yes, and in that, do you find that there's a difference between sort of the modeling that you're doing for more research-oriented purposes versus more decision-making purposes, or are they pretty much overlapping in this case?
So, I mean, I think there's a large amount of overlap. So what we're seeking to do, I mean, I can translate this to the project I've touched on a couple times, and that's where we're looking at like cell data and GPS data that gives us an aggregate of social distancing. So, we're looking at how this social distancing using time series modeling impacts various health outcomes and COVID outcomes and things like that. But we're also, we set ourselves up in our center so that our methods and our research is reproducible. So we're looking to basically, we want to look at these things in real time. So, we're doing all of our lead work, we're doing all of our data visualization, we're building our apps, and then what we want to do at the end of the day, and actually even write summary reports so that we can get them out. We are concerned with interpretation and generalizability. We don't want to be one of those that just tries to get our stuff out there as quickly as possible and then have to retract it. But the point I'm trying to make is that we are working in real time, timely, so that when, say like September, October, November come along, we repeatedly download our data sets so that we can then feed them into our models and update our results very quickly. That's what we're looking at doing. So thinking back to the university then, if you have basically a system set up and you can basically look at it in real time, I think that there's some good synergy there with the way that we're currently thinking.
Great. Yeah, that sounds really interesting. Ron, you wanted to jump in as well?
Yeah, I was going to build off that. So I think that's exactly right. And I think, again, the modeling group that we're working on is academically oriented, and we're using the best sort of academic principles, but it really is about decision making in the fall. That's the goal, is sort of the safety of the students. And I would echo what Alex said, which was, you know, trying to do this work too fast and get it out there too fast can be dangerous. I was kind of Googling around yesterday, looking up some literature, and I found, I won't name the person, not at Virginia Tech, but who had built a model who had predicted this virus is going to be gone by June, and oh my goodness, we're only going to have, you know, 500,000, you know, deaths. And with 99% certainty, that model was put out there. It's a press release, you know, and it didn't probably go through peer review, and that's really unfortunate, because that leads to these issues of the public being confused about what is going on and who should I believe and what should I do. You know, it is being really cautious. Modeling can be, it's a hard enterprise, and so you have to be careful and get it right.
For sure, definitely goes back to having that data, having good data and good information about what's going on. I just want to put out there for anyone who's interested in what VT is doing in the fall, you can check out www.vt.edu/ready. That will be a great place to find out the information. We're sort of getting to the end of our time together. Before we wrap up, I'd like to ask the panelists one last question. And that's how do you see our university initiative setting us up to really lead data science in healthcare, and sort of what's next? And maybe, Alan, we'll start off with you in your industry partnership with Virginia Tech.
Yeah, I think one of the things that's really interesting, and I'm in a fortunate position because I live in Blacksburg. My wife works at the university. My brother's a professor at the university. So I see a lot of these things from different angles. And what I'm most excited about is the evolution of our university to more cross-discipline research and cross-discipline partnerships. Years ago, it seemed like the entire university was a set of silos of departments. It was very difficult to work together. Today, we have programs like CMDA. We see data science showing up in engineering disciplines. We have the innovation campus, and all these opportunities for people with lots of different backgrounds to come to the table and have an honest dialogue about how data, statistics, mathematics, and computer science integrate to solve very challenging, difficult problems that we could not solve 20 years ago. Not that, you know, it's not because we have faster computers. It's because we're now thinking about the problem in different ways. And we're bringing this collaborative approach. And I think the fact that the Innovation Campus and like I said, programs like CMDA are now combining all these disciplines together is affording the university the opportunity to solve the next generation problems.
Great, glad to have your partnership with Virginia Tech. Sadaf, maybe you could give us a student perspective on how you see the university being involved in data science and healthcare.
So I think with the university's, investments in all these data science programs and projects, along with that new campus that is so close to, top hospitals and in a location that's quickly becoming a tech hub with many like analytics-driven industries surrounding it, that I really do think the university will be a top leader in healthcare analytics. And the only way for VT to go is forward, really, especially when you look at all the resources at the disposal, like the med school, and just think about like all the possibilities research-wise that can happen.
Great. Thank you. Alex, maybe you can weigh in as well.
Sure. So my response to this question is twofold. Firstly, Virginia Tech has really demonstrated a clear commitment to leading in data science and healthcare by, as you've said, the innovation campus and everything that Brandy had talked about early on, and also investing in my center. That is a clear demonstration of this commitment. And also along with innovative programs that are launching, that have launched recently, as we've talked about, and also those that are in the queue, as we think about biostatistics and health data science. So you know, again, our center, we collaborate with researchers across the health sciences, whether they're, you know, internal to Virginia Tech or external, FBRI, Covillion, and beyond. And we provide expertise to these folks that ranges from study design to dissemination and all kinds of other things. But, you know, really committing to a center like ours, it says a lot. And secondly, this might be a little bit off topic, but using data analytics, we are seeing the impact of university decisions and policies, like moving to distance learning. We're seeing these decisions making a big impact on behaviors with respect to social distancing way before policy takes place. So in more university-driven areas, of course. And then, of course, the policies, you don't really even see a blip in the curves. Whereas in areas that really don't have universities, the social distancing really didn't take effect, if at all, until the policies took place. And then, of course, this has a huge impact on public health outcomes.
That's really interesting to hear about the sort of partnership of the universities driving some of these, you know, mitigation strategies before there's some level of, you know, larger scale implementation of them. So that's really great to hear about. Ron, can you tell us a little bit about the university initiatives in data science and healthcare, and, you know, where you think VT is going in that way?
Sure, and I'm just going to echo in some ways what my colleagues here just said. That is, we started at the top of that hour and a half talking about Innovation Campus, and undoubtedly there's going to be a big data science push up there, and undoubtedly there's going to be healthcare involved. I mean, Innovation Campus, SADOF's program, right? The DAAS, Data Analysis and Applied Statistics program, has a strong data science piece to it. Undoubtedly there'll be healthcare in that. All you have to do is go out to Roanoke and look at the Fralin Biomedical Research Institute and the new building that's going up out there, and Alex's group, to see that we've got a lot of things going on there. The partnership with Socially Determined is huge. So all those things are coming together. I think sometimes people get confused because there isn't a data science program, or there isn't a data science center at Virginia Tech, and they think it's missing. But it goes to what Alan started out saying, which is, I think a strength of Virginia Tech is no one organization, no one college, no one group owns data science. It's spread throughout the university, and it's partnerships between all kinds of different organizations. In this case, this hour and a half has made it clear, like with Alex and Alan, the partnerships they've got going, right, that are working. So I think that's huge. I think it's, again, sometimes confusing because you can't point to the belly button of Virginia Tech that's data science, because it's, I think, infused throughout the organization. So I think we're well poised to do incredible things in the coming years in this space.
Yeah, what an exciting time for the Innovation Campus to be getting started with all the data science interest at the moment. So thank you to all the panelists for being part of the fantastic conversation today, and thank you very much for all of your hard work and you know, accomplishments in the area of COVID, which was a big focus for today. Your insights provided us with a unique perspective on data analytics and how we can use it as it applies to our health. And I want to thank the Illuminate program for putting together this panel and all of the great insight that's come out of it. And finally, I want to thank all of you that came to participate in the panel, all the great questions that were out there. We apologize that we couldn't get to all of them in the hour and a half, not nearly enough time to, you know, talk about all of the things that are happening. And we are grateful to those of you who joined us today. Let us not lose the momentum. Please continue to engage with Virginia Tech. There are many ways to do that. Connect with your alumni chapter, attend other virtual events that we're having, sign up to be a mentor to other Hokies, or make a gift to your alma mater. And thank you again for spending time with us today. Go Hokies.